There is a push for better skin cancer awareness in rural Colorado, especially among farmers and ranchers. Health organizations, including the American Academy of Dermatology, report skin cancer as the most common cancer in the U.S., and Colorado is one of the top states for skin cancer risk. Our Bill Folsom is looking into the issue.
Skin cancer screening is important for everyone. There is an issue of putting it off among many who live rural. Raising alpacas and other livestock are the livelihood and lifestyle at Red Barn Ranch.
We really wanted to do a lot more as far as the agritourism and educating people about farming and ranching and taking care of animals.
Colorado's wide open plains work well for raising animals. There's also a lot of sun exposure.
Yeah, I'm outside a lot.
Chris Shade enjoys his time outside. He also knows it's a threat he needs to monitor.
Skin cancer itself is in my family. My dad was always fighting skin cancer, kept cutting it off, burning it off. He ended up with squamous cell carcinoma, which metastasized, and that's what ended up killing him.
Unfortunately, when you're located in a difficult area to access care, your risk and the size of these cancers when they're diagnosed is often much higher.
Dermatologist Dr. Braden Healy points to increased risk factors for Colorado farmers and ranchers. There's the increased sun intensity from living at altitude. The agriculture outdoor workplace increases exposure to damaging UV rays.
The ability to get care in a rural area is really difficult. You have to arrange time off work, difficult rides, take a whole day to take a trip to the doctor.
And then diagnosis and treatment gets put off due to distance and the inconvenience of getting to a doctor.
But by the time we make that diagnosis, they do have advanced stage cancers as compared to those who might live in an area like Colorado Springs and have easy access.
I think that's why farmers and ranchers are more susceptible, because we're more focused on taking care of our animals or our equipment or our livestock than we are ourselves.
Because of his family's skin cancer history and a wife who has had some skin cancer scares, Shade has adjusted his attitude about regular visits for skin cancer screening.
I just had some things on my neck and they did biopsies. Nothing was cancerous, but I did have a big cyst that they had to remove. I had some precancerous spots here. You know, and if it's precancerous, that's the easiest time to catch it and treat it.
They're at a very high risk of developing skin cancers and more advanced skin cancers, so our goal is to stop that in its tracks.
If you see something that don't look right, just go get it checked. Then that way you can sleep better at night. You're not waking up in the middle of the night saying, oh, I wonder what that is.
Dr. Healy and colleagues are working to counter the inconvenience of having to come to the city. They're now offering some clinic hours out in some rural areas like Hugo and down in La Junta. In El Paso County, Bill Folsom, News 5.